Welcome again to the Medical Terminology Podcast. This episode is Chapter 15, Part 2, Imaging Techniques. Our first term is radiology, radiology. In its most general sense, radiology is the specialty of diagnosing or treating disorders using radiant energy. A radiologist, radiologist, is a specialist in using radiant energy to either diagnose or treat diseases and disorders. Now, in conventional radiology, also known as the X-ray, we have an imaging technique in which X-rays expose a film to visualize hard tissues. And the actual X-ray film itself, that is the product of this process, is known as a radiograph, radiograph. Our next term is contrast, contrast. A contrast is any substance that makes a body part visible. And we have two types. First of all, we have a radiopaque contrast. Radiopaque, radiopaque. Radiopaque is a substance that does not allow X-rays to pass through. On the radiograph, they appear light in color. On the other hand, we can also have a contrast that is radiolucent, radiolucent. This is a substance that does allow X-rays to pass through, and it appears black or dark gray on the radiograph. And then we have barium, barium. Barium is an example of a contrast. Barium is a radiopaque contrast medium that's used to visualize the gastrointestinal tract. If you remember from back in the chapter on the digestive system, we had a procedure known as a barium swallow, in which the patient drinks barium. That then makes the upper gastrointestinal tract visible to an X-ray. We also had the barium enema, in which an enema of barium is given to the patient, and this makes the lower gastrointestinal tract visible. And then we have some terms related to radiographic positioning, and there's actually a diagram of this in the textbook. And these terms can be a bit confusing unless you understand what the unstated key is. The unstated key or logic to this terminology is that the terminology refers to the direction of the X-ray beam from the camera to the film. And if you refer to your textbook, we can look at some of these examples. First of all, we have posterior anterior, posterior. It's literally the words posterior and anterior fused together. Now, if you look at the drawing in the diagram, the patient is facing the film, and the back of the patient is to the X-ray beam. So the X-ray beam direction is from the back, posterior, to the front, anterior. And that's how the term works. On the other hand, we can have the anterior-posterior projection or position. And if you notice in that diagram, the patient is facing the X-ray beam, and the patient's back is to the film. So the X-ray beam is traveling from the front to the back, anterior-posterior. So that's the logic of those terms. If you remember the logic, it won't be a problem. Then they have the lateral projection, and lateral just means sideways, and you'll notice the patient is sideways to the film and the X-ray beam, and the X-ray beam is going from one side of the patient to the other. And then finally we have the oblique projection. An oblique, oblique, means slanted, and you'll notice the patient is slanted towards the film. And we technically have the left oblique and the right oblique positions depending on how the slant works. In the left oblique, the patient is slanted to the film, and the left side is the side that's going towards the film, left oblique. The X-ray beam then goes from the right to the back left. And in the right oblique, it's the other way around. The patient is slanted to the film, the right side is towards the film. Okay, so the radiograph is one technique of imaging. It's using the X-rays to expose a film. We also have variation on the X-ray, and that is called the computed tomography. COMPUTED, then tomography, TOMOGRAPHY, computed tomography. Now, tomography literally means to cut something. And in computed tomography, a thin-shaped X-ray beam passes through the body, and special X-ray detectors send information to a computer, which creates a cross-sectional image. So this is a fancy computer-enhanced X-ray. And what makes it special is, again, it's able to create thin slices of the body. And the X-rays are actually digitally created on a computer screen, which then, of course, they could be printed out. So computed tomography is where we have thin cross-sectional X-rays, as opposed to the traditional radiograph. A third variation on the X-ray is fluoroscopy, FLUOROSCOPY, fluoroscopy. And in fluoroscopy, the X-ray beam is projected onto a luminous screen. And so the image is appearing live on a screen as opposed to exposing film, which is then developed. Okay, so that covers the imaging techniques that involve X-rays. We have the conventional X-ray, the conventional radiograph. We have computed tomography, which is the computer-enhanced X-ray that can do the cross-sectional imaging. And then we have fluoroscopy, where an image is projected on a luminous screen. And then we have techniques that involve completely different processes. The next one is magnetic resonance imaging, often abbreviated MRI. Magnetic resonance imaging uses a combination of radio waves and strong magnetic field in order to create signals that are then sent again to a computer, and it creates cross-sectional images. Now, magnetic resonance imaging has an advantage over X-rays in that it is very good at distinguishing tissue densities, particularly distinguishing soft tissues. Whereas soft tissues on an X-ray are just all one shade of gray, you can get different shades of gray on an MRI, so it can distinguish soft tissues. Whereas the radiograph, the traditional X-ray, is best at doing hard tissues. Well, then we have a sub-branch of radiology known as nuclear medicine. Nuclear medicine is a general term for the use of radiopharmaceuticals for either diagnostic or treatment purposes. And that's an important thing to remember. Nuclear medicine is the most general term. It refers to diagnosis and treatment. Sometimes people just focus in on the diagnostic part and forget the treatment part. Okay, so if we're talking about diagnosis and treatment, it's nuclear medicine. And again, it uses radiopharmaceuticals in its processes. Now, what is a radiopharmaceutical? Well, a radiopharmaceutical, radiopharmaceutical, is a substance that emits gamma rays, a special type of radiation. These substances emit gamma rays that can be detected by a gamma camera. And the gamma camera detects these substances within the body and is able to create images from it. And the substances that are administered to the patients are specific to the body system that's being diagnosed or treated. Now, the product of nuclear imaging is called a nuclear scan. This is the diagnostic part of nuclear medicine, a nuclear scan. NUCLEAR scan. And as a secondary term in the textbook, they give us the term scintigram. SCINTIGRAM. The scintigram is the more technical term for an image that is created using nuclear medicine techniques. That is, again, it's using a radiopharmaceutical that can visualize organs or body systems that cannot be seen on conventional x-rays. That is really the advantage of nuclear medicine. It can see all kinds of things that x-rays cannot. And the textbook mentions a couple of examples of nuclear imaging. For example, we have the bone scan, BONE scan. A bone scan would refer to nuclear imaging of the bone. And this can identify areas of bone growth, areas of breakdown, and it can also be used to detect bone cancer. Another example of a nuclear scan would be a thyroid scan. THYROID, thyroid, we know that by now, I hope, and scan. And a thyroid scan visualizes the thyroid, and in this case, the radiopharmaceutical is a form of radioactive iodine. Iodine is a substance that has an affinity for the thyroid. It just gets sucked in by the thyroid. So if you give the patient radioactive iodine, it is going to seek out the thyroid. It's going to be absorbed by the thyroid. It will then make the thyroid visible to the gamma camera. And we have two types of procedures that fit the category of nuclear scans. The first one is the single photon emission computed tomography. That is a mouthful. Single photon emission computed tomography. And that is a nuclear imaging technique that creates 3D computer images, and it is particularly good at showing blood perfusion. It can show the flow of blood within the body. It can show the blood flowing through the arteries and veins. It can show it flowing up to the brain, so it's good for detecting risks of stroke. And it can also show it flowing into and through the heart. A second type is the positron emission tomography, and it's often abbreviated PET, P-E-T. It's a nuclear imaging technique that creates images of the whole body or selected organs. It is particularly used to detect cancer and to track the effects of cancer treatment. The next category of imaging we have is ultrasonography, ultrasonography. And we've encountered this term before, I think even going all the way back to Chapter 1. Ultrasonography is the process of using sound waves to image deep body structures. And the product of an ultrasonography procedure is a sonogram, SONOGRAM. That is the general term for an image created using ultrasound. And then ultrasound images can be named more specifically for the body part that is involved. And this goes for both the process and the product. For example, we have echocardiography, ECHOCARDIOGRAPHY. Echocardiography is the process of creating a sonogram of the heart. And the sonogram product would be echocardiogram. Another example would be carotid ultrasonography, CAROTID, and then ultrasonography, ULTRASONOGRAPHY. And this is the process of creating a sonogram of the carotid artery. It would be a way of diagnosing whether the carotid is plugged up or not, and whether or not the patient is at risk for stroke. Okay, well now we're going to go ahead and do some practice with all of these terms related to imaging techniques. Number 1, what is the term for any substance that makes a body part visible? That's a contrast medium. Which imaging technique uses radio waves combined with a strong magnetic field to visualize soft tissues? That's magnetic resonance imaging, abbreviated MRI. What is the general term for the use of radiopharmaceuticals to diagnose or treat disease? Notice I said diagnose or treat. That's nuclear medicine. Don't say nuclear scan. Okay, nuclear scan is just the diagnosing part. If we're talking about diagnosing or treating, it's nuclear medicine. What is the medical term for the specialty that involves using radiant energy to diagnose or treat disease? Well, that's radiology, radiology, and it can also be used to refer to just using X-rays. In the conventional or traditional sense, radiology was X-rays, but that was before we had all these other techniques using other forms of radiant energy. What is the term for the radiographic projection in which the patient is facing the X-ray film? The patient is facing the film, so the back is to the X-ray beam. We want to label it based on from the beam, from the camera to the film, so that would be posterior anterior. Posterior, posterior anterior. Which imaging technique uses a fan-shaped X-ray beam to create cross-sectional views of the body? That's computed tomography, COMPUTED, tomography, TOMOGRAPHY, abbreviated CT. And again, this is a form of X-ray. It's a jazzed up X-ray where we have the very thin cross-sectional pictures taken. And rather than exposing film, we are using X-ray detectors to create a digital image on a computer. What is the term for an image created using radiopharmaceuticals? Okay, here we're talking about just the image, just the diagnosis part. This would be a nuclear scan. Also, we could say scintigram, SCINTIGRAM. Which nuclear imaging technique uses radioactive iodine? Well, that's the thyroid scan. Again, the thyroid has an affinity for iodine. It will suck that radioactive iodine into itself, and that will make it appear to the gamma camera. Which imaging technique is used primarily to visualize blood perfusion to the heart or to the brain? That's the positron emission tomography, POSITRON, emission EMISSION, and tomography, TOMOGRAPHY, often abbreviated PET, PET. What is the term for the process of creating images using ultrasound? That's ultrasonography, ultrasonography. What is the medical term for using ultrasound to visualize the heart? That's echocardiography, echocardiography, echocardiography. And again, that's the process of visualizing, that's the procedure. The resulting product would be what? That would be the echocardiogram, echocardiogram. And finally, which imaging technique involves X-rays projected onto a luminous screen? That's fluoroscopy or fluoroscopy, fluoroscopy. Okay, that covers it for the imaging techniques. In the third and final part of Chapter 15, we're going to look at pharmacology. This ends this episode of the Medical Terminology